Good evening and welcome to a special NMPBS virtual town hall. My name is Conroy Chino and I will be your host and moderator this evening. We are broadcasting remotely from the Indian Pueblo Cultural Center here in Albuquerque. We're glad you could join us and we're hoping you plan to stay with us for the next hour. Tonight, we are focusing on the deadly coronavirus and the impact it's having on New Mexico tribes. The virus, known as COVID-19, has infiltrated cities, towns, and counties all across New Mexico. In recent weeks, it's hit tribal communities especially hard, driving up the number of positive cases at an alarming rate. Recent data from the New Mexico Health Department shows that Native Americans make up 37% of all COVID-19 cases, most of them clustered in the northwest quadrant of our state. That number is alarming because Native Americans only make up 10% of the state's entire population. The spread of the virus across Indian country has tribal leaders and our state governor extremely concerned. A little later in our town hall, we are going to hear what's being done to minimize the threat and to protect families from this deadly disease. We're also going to hear what's being done to assist families with basic essentials like food, water, medication, healthcare, especially for those living in rural areas. This evening, state health experts will provide crucial information of what it's going to take to stop the spread of this contagious respiratory illness, along with ending the grief and the sorrow. We'll also hear what's happening in Congress and the economic relief effort, as well as what the state is doing about the record number of unemployment claims and who can qualify. Finally, we have messages of hope coming from everyday people living in tribal villages, communities, and urban areas all across our state. But first, we start with a message from New Mexico Governor Michelle Lujan Grisham, who joins us for tonight's town hall. Good evening, Governor, and welcome.
Oh, good evening, Conroy. Thank you very much for hosting, and thank you very much for helping lead and showcase any number of leaders in the state who are really concerned about managing and containing the virus to the highest degree and really have the public health and safety of every New Mexican, but particularly now our Pueblo and tribal communities, making sure that we do everything in our power possible to prevent any additional spread and doing everything we can to protect these rural communities who have long been disadvantaged by both not having a federal trust responsibility for healthcare, economic security, and any related infrastructure investments ever met, and states who have different relationships with their sovereign nations. And while I certainly believe that I'm lucky enough to have incredible relationships with our sovereign nations, that's not the case in every state. It makes it much harder, particularly for sovereign nations, in my opinion, like the Navajo Nation, who are navigating the federal government, Utah, Arizona, and New Mexico state governments. And their leadership can sometimes be, I think, minimized, even though it's incredible leadership, quite frankly. I'd like to see more governors and more of that leadership at the federal level that I'm seeing with President Nez and Vice President Leiser in terms of really being clear that you do everything you can to protect the public with strong public health measures and public safety measures. But it does make it really challenging. And I want to just highlight these three things. One, we knew early in New Mexico that rural communities, irrespective of whether they're sovereign nations or not, are more challenged in addressing any of these issues to this deadly invisible virus. They have to travel for food, right? Great distances, and water and other day-to-day supplies. And that's how this virus moves, right? It's on something, or it's on a person, or it's in a person, and it moves with you. And so that person-to-person contact, that creates risk and spread. And they don't have the same opportunities. You know, if you're living in a community without broadband or internet, how are you supposed to order things to be delivered to you? I mean, none of the things that work in urban areas in this state or around the country are even remotely available to rural communities. Now take language barriers, cultural barriers, and any number of issues where it is really hard to create a productive public health infrastructure that protects communities. And so we knew we were going to have really significant challenges. So I want to just focus on the second thing is we did a lot of things right well before anybody anywhere in the country really got their arms around it. Look, tribal nations on their own stopped gaming early, right? We did that. Our first cases were on March 11th. In that week, we began to get really aggressive decisions made by the leadership around the state to close their gaming enterprises, their tourism enterprises, and hotels at huge economic risk to sovereign nations, but did that to protect their communities and their tribal members. Two, they began to work with us on community containment strategies. That means that we bring food and water and supplies and triage centers in. We've done probably the only real surveillance testing for people who were doing COVID-19 testing to whole communities, right? Like San Felipe and Zia, and we're at Zuni now, and we've been doing others. And we're going to do more because we know that the risks are so great. And for H1N1, we learned with that respiratory and flu that the mortality rates for Native American individuals was 4 times higher than any other population. That significant issue in and of itself, and the fact that what we already know about COVID-19 is that coexisting chronic issues like diabetes exacerbate how deadly this virus is. So we have an even greater obligation to try to protect our communities. And that has gotten national attention. Again, it took all the leaders that are on this call and others to really focus. So we are hopefully launching enhanced testing with the Indian Health Service. They'll get testing supplies in, both mediums to swab, right, the front end, and the reagents on the back end. So it's more samples, so we can do more work. We're going to do more surveillance on our own. We're going to work on more public health messaging. We're going to make sure that we do more community containment and triage centers right in our Native populations, whether that's in chapters or pueblos or regional areas. We're trying to work with Arizona and Utah in a more succinct and credible way so that we have the same efforts going on. That makes it easier to manage for the leadership at the Navajo Nation. So I am really pleased, Conroy, with what we're doing, but I'm very worried. Once this virus presents itself into a small, tight-knit, very familial, proud community, it presents without robust healthcare services inside these remote rural communities. It presents significant challenges. So the last thing I want to say is this town hall is an opportunity to talk about those specific issues, to be really clear about how we need each other in this effort, and that every single strategy and idea must be deployed to protect our sovereign citizens to the highest degree, and to be completely unafraid to use any strategy that saves a life, that makes a difference, that keeps intact our proud sovereign nations. And what I want people to know is that I will do whatever it takes to protect as many New Mexicans, with a special emphasis on our tribal populations and communities for the reasons I stated at the beginning of my presentation.
Governor, thank you very much. Thank you for your time. And we really appreciate the bold, decisive actions that you've taken to date. If there was just a single sentence or two that you could send out to those communities that are really struggling with the coronavirus, there are many families out there, children and elderly, who are extremely concerned, scared, and terrified. What words of assurances can you give them?
Well, I have real hope for getting through this in a way that shows that we are stronger and more resilient as a community, a state, if you will. by working together. And I don't want people to be afraid. And I know that they are. I want them to be concerned in a way that helps us address this problem to the highest degree. But when families stick up for each other and they protect each other and they listen to the incredible messages from their leaders, please stay home. We'll bring things to you. Support your neighbors by staying home. Know that the way that you attack this virus, and we're going to attack it, it's by don't let it into your home. Don't let it into your family. Don't let it in to the place where your community gathers. Don't let it in to your place of worship. And you don't let it in there to these sacred places, right, that have long held us up by not allowing it to go there with us. And the way in which I've learned to understand, and I'm not an expert, Conroy, but the way in which Native American people in particular honor their past and their elders, who know about positivity and hope and resilience against unspeakable tragedies at the hands of this country, poor decisions, terrible efforts, protecting your cultural ways, your spirituality, and your sacred sites has never wavered. That attitude, do not let this virus present itself to any of those places, whether it's in your heart, in your home, or in a sacred site at your village. That's how we kill it. That's how we protect each other. And that's how we honor our long-standing traditions. And if we do that together, we will get through this, and we will protect many more people by virtue of standing up against this virus in this way.
Thank you, Governor. Thank you for your words, and thank you for joining us.
Absolutely.
More
Thank
from
you.
We continue our town hall with our first group of panelists. They've been expending a significant amount of time and energy addressing this growing health crisis in Indian country. We are joined this evening with Indian Affairs Secretary Lynn Trujillo. We also have the President of the Navajo Nation, Jonathan Nez, and the Governor of Laguna Pueblo, Will Herrera. And lastly, we have Congresswoman Deb Haaland, who's taken some time off from her congressional duties to spend some time with us this evening. Welcome to all of you.
Thank you.
Thank you for having us.
Welcome. Thank you. Thank you, Conroy.
Mr. President, I'd like to start with you. You know, we've all seen the latest numbers coming off the Navajo Nation, and for you, as a tribal leader, they've got to be extremely distressing. Can you just share with you some of your concerns?
Thank you, Conroy, and thank you to the other people on the panel today, Secretary Trujillo, Representative Haaland, tribal leaders, for having us on this New Mexico PBS virtual town hall. And Conroy, we have right now tested over 5,038 of our Navajo citizens. And just yesterday, we got word that there are 1,042 positive cases. 3,440 have come back negative results. So there's still over 500 tests that have yet to be verified. 41 deaths, one way too many here on the Navajo Nation. You know, throughout the United States, the Navajo area IHS in the positive cases represents 57% of the total cases within the Indian Health Services. 57% overall throughout Indian country are on the Navajo Nation. And I'm sure tribal leaders will talk about, you know, the high rates of health problems in our communities that play a factor in some of our complications and the deaths of COVID-19. But I wanted to talk about, Conroy, the healthcare system. not just in tribal communities, but the healthcare system all across the country and the need for improvements there. I think everyone recognizes that there needs to be an improvement in our healthcare system, more so in tribal communities. I mean, I want to say to our warriors on the front line that our doctors and nurses and our police officers, our first responders, thank you so much for your bravery in protecting our citizens. And that goes clear across the country. Our warriors battling this monster called COVID-19. And I think this type of segments and interviews have really highlighted the underfunding of the Indian health services throughout the country. And, you know, every year, Indian Health Services, Bureau of Indian Affairs, Bureau of Indian Education tends to not get fully funded. And we have in tribal communities, tribal leaders have had to advocate in Washington, D.C. for direct funding. Monies that get appropriated going straight to the tribal people. And, you know, we're still using the same process as we do every year in getting funding to our people. And yet this is a public health emergency.
Absolutely.
You know, we need to get those dollars straight to our governments, not passed through federal programs or passed through the states, coming directly to tribal communities. And lastly, Conroy, I want to say thank you to our governor, Governor Michelle Lujan Grisham. I want to say thank you to Cabinet Secretary of Indian Affairs, Lynn Trujillo, and the many volunteers who came out to the Navajo Nation. We're awaiting federal dollars to come in our tribes, and we just can't wait. And the Navajo Nation had to reach into our own pockets, just like many of the tribes throughout the country, to help out in this emergency operations. And the compassion of our people out there. And you mentioned, Governor mentioned that there are positive stories, really heartfelt stories of how our citizens are stepping up and being warriors, being out there for their elders, getting their supplies and their food directly to them. I mean, that's a true warrior. And I want to say thank you to all the tribal leaders here for being those leaders. And there is a lot of fear, there's a lot of uncertainty out there. But when they see you, tribal leaders, when they see the governor handing out food and supplies, and that brings a lot of comfort to our citizens out there and lessens that fear. So thank you for the work that you all are doing, and God bless each and every one.
Well, thank you, Mr. Prince. Thank you very much for your time. You know, one of those warriors that's on the front line is my son. He's a surgeon over at Tuba City Medical Center, working triage. So appreciate your words. I'd like to switch gears here, Mr. President, and go to Governor Herrera. Governor, can we switch from health to economic impact? You know, as the governor mentioned earlier, those of you who are in the Pueblos that have gaming facilities have chosen to honor the wishes of the governor and shuttered the casinos and hotels and other businesses. And that's really created a huge impact on the Pueblos. Can you just share a little bit of what that's like and what you're hearing from some of the other Pueblo governors who are part of the All Pueblo Council of Governors?
Yes, thank you, Conroy. And again, Guati Hopa. I just wanted to also, first of all, recognize Governor Grisham, President Nez, Congresswoman Holland, Secretary Trujillo, and others that are on this town hall also. I know this is where we're trying to tell our story. And I am representing the collective group of the All Indian Pueblo Council of Governors, which is the collective group of the Pueblos in New Mexico. And we do have one, Isleta del Sur, also that's part of our collective group, the All Pueblo Council of Governors, APCG. So what you've asked me to express, Conroy, is again very important to understand our story in regard to, the Pueblos have, in a sense, as Governor Grisham has mentioned, we sat down and discussed, but even before that, there was already decisions made by some Pueblos to voluntarily close their casinos. This wasn't an easy decision because, as we know, this is the revenue base for a lot of Pueblos and tribes across the country. Here in New Mexico, the Pueblos, for example, in 2018, a economic impact study showed that our Pueblo businesses and gaming operations collectively generated over $608 million into the state and supported over 11,500 jobs. They also generate over $1 billion in sales that come into our state while supporting non-tribal local businesses through purchase of goods and services of over 222 million. And so these numbers are significant. That gives you really that story of how the Pueblos have created their own economies, have achieved a level of success, but now are also in a position where these closures are very seriously impacting our ability to provide the level of services and programs that those revenues that we generate go to our communities to provide for our people. And so this is an example of that.
Congresswoman Deb Haaland, perhaps you can maybe share with us what the federal government may be able to do in maybe some of the economic relief efforts that can come to the Pueblos and to the Navajo Nation and also to the two Apache tribes. Congresswoman, if I could just have you maybe quickly go over a quick review of what that economic relief effort looks like and perhaps how soon tribes might be able to tap into the money that's been appropriated by yourself and members of Congress.
Thank you so much, Conroy, and I'm honored to be on this town hall with President Nez and my governor, Governor Herrera, and of course Secretary Trujillo. Every single community in this country deserves access to the tools to fight this coronavirus. It seems, though, that many communities of color are at a higher risk of being ignored. I just want to say that Indian country across the country has been left behind for decades, underfunding for decades, both with our healthcare system, with our infrastructure, with broadband internet, for heaven's sake. Those are all things that we're behind in. And if we had been up to par with that infrastructure, perhaps we'd be in a much better place now. I'd like to say that as co-chair of the Congressional Native American Caucus, I was calling leadership nearly every single day to make sure that we had a set aside for tribes. We started at 20 billion, we ended up with 8. And so that is money, $8 billion is money that would go directly to tribal governments. The tribal governments know what they need and how to spend and what the emergency looks like in their own communities, and that's what we wanted to do. We're advocating every single day for our tribes, every step of the way. We're talking to leadership. We're holding FEMA, IHS, CDC, HHS accountable for the management of those resources. I've been on several calls with IHS and appreciate the job they're doing, but also remember what I said, they have been underfunded for decades. So we are doing everything we can. I am advocating in this next legislative package to make sure that tribes get more funding, that they're included in the economic stimulus packages. And so we're doing that every single day. I just want to say that I truly appreciate and encourage everyone to look at the plan that Secretary Lynn Trujillo and her team put together for Indian tribes here in New Mexico. I think that's a model for every single state, and that with all of us working together to get past this terrible health crisis, that we will get past it together. And so just know that I am advocating every opportunity I have to make sure that Indian country has the funding. This next bill, we're working hard to make sure that an emergency broadband piece gets into that package. And so we'll just keep working.
That's really a critical piece, Congresswoman. Thank you very much for offering that kind of information up to the leadership and to those that are watching our town hall. Thank you very much. Madam Secretary, you've expended an incredible amount of time working with the leadership. It's been nonstop. You know, there's reference to those guidelines that you offered up to the tribal leadership. Why was that necessary, important for your department to do and to share with leadership?
Well, thank you, Conroy, for that question. And before I respond, I'd just like to say, Hina Makima Shewimba, good evening, and thank you to everyone who's tuned in tonight. I also want to thank President Nez, Governor Herrera, and Congresswoman Deb Haaland for their leadership and their advocacy during this time. Our department collaborated with a number of individuals on this document. We knew it was necessary to create a document that would serve as guidance for our tribal leaders to address COVID-19. You know, our goal in all our work as the department is to provide assistance to our tribal communities in preparing for and for mitigating the spread of the disease. We know that over the past few weeks, as COVID has spread, there's been growing apprehension about the impact and, you know, what the impact will be on our families and our way of life. And so we wanted to offer this to leadership, to communities. It provides guidance related to, you know, isolation, thinking about what to do to, about getting testing. So we really wanted to make sure that we could do everything possible to offer resources and to continue to share critical information with our leaders, with you, the public, because we know that we'll get through this together. We can't predict the ultimate course of this public health emergency. So our state, our governor, our fellow cabinet secretaries, and our tribal leaders are doing everything possible to slow the spread. And so that's really the spirit that we offered this guidance in.
Thank you very much, Madam Secretary, and I appreciate your time and the time given to us by all of our participants on this on the town hall. Mr. President, thank you very much. Congresswoman Haaland, thanks again for spending time with us this evening. And Governor, thank you very much. And Madam Secretary, especially for all your efforts. And our thanks to all of you for your efforts, your courage, and your persistence in battling this pandemic. For our audience, we have messages of hope to share with you tonight. We have embedded them throughout our broadcast this evening. If you would, please take a listen, and we'll join you on the other side.
Let's take care of one another by staying home and being safe so that we can gather in the kitchen, cook a meal, and laugh together again as one.
To my Navajo people, Ernest David Sosa here. Just want to give you a message of encouragement. This virus has brought us all together, and I want to ask you to renew your minds, right? Start thinking as we and not I, and just stay indoors and listen to the authorities, and let's get over this virus.
Hi, I'm Leah Cristobal from the Pueblo Santa Ana, and I want to say be well, be positive, be resilient. Prayers and blessings to all.
Hello, brothers and sisters. This is Anthony and Shannon Flagg with the Native Health Initiative, bringing you warm wishes, a reminder that in this moment we all are called to protect our elders, protect our families, protect our communities. That is the way we show resilience and love for our communities in this pandemic moment.
And if you are interested in supporting the community, there are various resources and also established funding, but if the community needs further support, they can connect with the health partners.
And you can see our support program that we've developed at our NHI website, lovingservice.us, both a chance for people who are in need and also people who want to give and support others. Blessings.
Welcome back. The coronavirus has presented some very unique and difficult challenges for 3 New Mexico cabinet secretaries that you'll meet here shortly. They have been dealing with some very perhaps unusual situations out there across New Mexico. Joining us this evening with some important information is the Cabinet Secretary from the Department of Health, Secretary Kathleen Kunkel. Also joining us is Dr. David Scrace, who is the Secretary for the Department of Health and Human Services. And finally, we have Bill McCamley, who is Secretary of the Department of Workforce Solutions. Welcome to all of you, and thanks for being here with us for our town hall. Secretary Kunkel, if I could start with you. Recently, there was some data, numbers that were released by your department that showed a spike, a surge of positive COVID-19 cases in tribal lands. Can you share with us the data and what the significance is of those numbers and why we're seeing such a surge in tribal communities?
Thank you, and thank you for having me on the program this evening, Chino. We anticipated that there would be a surge in the Northwest. And I think Dr. Scrace, Secretary Scrace, has more of the epidemiological information about that. But the reason I believe we saw the spike is that tribal communities live in largely rural areas, and they live in large family units, multiple family units, and they engage in community support and community activities. And those are the very things that put them at risk for the spread of the virus. So as distressing as it is to see the spike, it's not too surprising because the very qualities that make tribal communities unique are the very qualities that put them at risk. And so the only weapon we have is social distancing. There is no treatment, there is no vaccine. So social distancing is the protection to prevent the spread of the virus. And that is the one element of tribal life that is highly unusual. Social distancing is not the way tribes live their lives.
Correct. Let me ask you this, Secretary Kunkel. Besides all the preventative measures that have been put in place, what about testing and contact tracing, which is a new term I heard not too long ago? But has the Department of Health been able to work with the Indian Health Service to be able to provide much needed testing so that you can better understand the virus and perhaps what's behind the spike in the numbers?
Well, testing has been a huge effort by the Department of Health, and there was some epidemiological surveillance, meaning we were just testing in general back in late February, early March, before we were seeing positive cases. So that was the beginning, and there were some tribal numbers in there. But since then, the Department of Health has had a very aggressive testing campaign where we were going, we set up 60 sites around the state, sometimes in tribal communities, sometimes not. But we have drive-through testing, which was actually originated by Dr. Aralu in the Navajo Nation. He had the first drive-through testing site, which we then picked up and put throughout the state. But even with that, when we started to see the numbers climb, particularly most recently in the last week or two, we have created a very focused testing program, going to tribes and testing as many people as we can so that we can try to get ahead of this. It's a vicious virus though, and testing alone is not going to be the solution. But we are testing very, very rapidly. We're trying to get to every tribal community. There has been a lot of collaboration with the Indian Health Service, and I'm proud to say that. I don't think that that's always been true, and it got off to a bumpy start, and that's nobody's fault. I think we just they were working independently at the state, but we are now in close contact with Director Wakea and with Dr. Thomas, and we are sharing resources. And thanks to the governor, we are going to get more resources through the Indian Health Service, and we're working together on testing. As for serological, that is the future. We're still doing the kind of testing that everyone is familiar with the swabs. We're limited by supplies, just like the Indian Health Service. But as I said, we're sharing our resources and hoping to reach everyone. But looking forward, we may be doing some of the more advanced serological testing to see just where this virus is and where it's been.
Dr. Scrace, we've been reporting, we've seen a lot on the news about the number of deaths. And especially in tribal communities, have been very impactful. And families have been unable to grieve because they can't get close to a loved one who's passed on. Cultural ceremonies and rituals haven't been able to be conducted in the way they normally do or normally are. And it's really been difficult for tribal members to say goodbye and to do the kind of things that are important and necessary in a cultural setting. Can you speak to that in some way that helps bring, some, I don't want to say relief, but understanding perhaps of what this all means within that context?
Absolutely. That's a great question. As a geriatrician, I see a lot of older patients. Everybody's 75 or older. So pretty much every day I see patients. I see people and work with people who have lost a loved one. And it's a devastating thing when it happens, when it's expected. And it's even more devastating when it's sudden or after an illness like this that can proceed so rapidly. We know the virus particularly affects people who are older. The mortality rates are much higher in people who are older. And so this grieving process is really, really important to family members. And, that usually consists of a ceremony in both Native and other cultures as well, where you see the person and you realize that this is the start of a new phase for them and for you as well. When we lose someone who's close to us, every human being's natural reaction, or almost everyone's, is to be close to people. You want to be close with your family. You want that support. You want to share that grief. That research shows that talking about the person and sharing those experiences together does actually help people and help them get through the grieving process, which can take up to a year. And then many traditions, they have people come into the home and stay for days or weeks. And we understand that right now that's not a good option, because social distancing, as Secretary Kunkel mentioned, is the only way to fight this virus. And so, and the other factor here is that, often at funerals, it's older people who are attending. And so and they're some of the highest risk people, and so we know this is really hard, and we know there's sacrifices. It's not just funerals, there's other stages of life, graduations and weddings and babies being born where people are not able to be as close. And although this sounds a little counterintuitive, the one thing that we can all do to get back to where we can be close to each other and get support from each other is to stay apart for now. Now, this isn't the same, and I don't want to equate them, although death and resurrection and Good Friday and Easter can be connected in some traditions. But my wife and I sat on the couch last Sunday and with our son and went to an Easter service that was all the Presbyterian churches in the whole large diocese, 23 different churches. And it was funny because I thought it would be um, stiff and impersonal, and they were very creative in how they did it and ended up having it. It felt like a real Easter service, like all the other ones I'd ever been to, except we're in a church. And so I think we can be creative in
Right.
finding ways to connect when we do have technology that might help folks.
Correct. Let me ask a real quick follow-up question, doctor, and that is, a lot of families out there in these tribal communities that are, have seen the increase in the COVID-19 cases. Family and children and elderly are scared, terrified. They're not sure what's going on, maybe in some cases. I mean, they're doing all the things perhaps that you've described, the distancing and staying put. But what can families do to comfort their children and comfort their elderly in these very unsettling times?
I think that in most of these situations, when we're afraid, the thing that's most comforting is feeling like someone else hears ours and that we can actually share that we can say, this is scary, or I'm really worried about the kids, or I'm really worried about mom. And we have those conversations actually a lot in our family. My wife's a nurse and goes in every day to the hospital. Her mom is part of a vulnerable population. And so I think communication, and again, if you can do that and maintain social distancing in the same room with a small group, it's great. If you can do it on the phone with people and talk every day, particularly when in the grieving process, setting up those calls and talking about things. But I think voicing how we feel in these times, be it fear or grief or anxiety, can really help. And taking the time to listen to how we're all feeling, listening to each other, can really help. And that's one thing that you can actually do over the telephone. You don't have to be in person.
Dr. Grace, thank you very much for your time and those responses. I want to switch over to Secretary McCamley. Secretary, thanks a lot for being here this evening. As we mentioned earlier, many of the businesses on tribal lands have shut down, along with the casinos, hotels, restaurants. Some tribes have continued to pay their employees during this time period, but there's going to be a point where they're going to have to either seriously consider laying off people or putting them on furlough. What can your department, your agency, do to assist tribes with unemployment?
Sure. And thank you very much, Conroy, for having this conversation. We really appreciate you being here and allowing us to have this way to get our message out. We furthermore really appreciate many of the tribes working with this administration in terms of closing the casinos. We know how hard of an economic decision that was to do, but it is the right decision in order to help with the social distancing that Dr. Grace and Secretary Kunkel talked about. So we just want to express our appreciation and our gratitude for the tribes for doing that. As people move into unemployment, it is very important that individuals who find themselves laid off apply for unemployment as soon as they are not receiving wages anymore, as soon as they get that layoff notice. We are encouraging people, if they do have the resources, to go to jobs.state.nm.us and do that online if they can. I know a lot of folks don't have that resource, and we can address that if you'd like. But if you can apply online, if you have that internet capability, please go to the website and apply online. Furthermore, something very, very important to remember is that if you get on unemployment, you will have to certify every week. Last week, we actually had 16,000 people in the state not certify their claims. We are not allowed to give you money if you don't certify every single week that you're still not working, through the unemployment system. So please remember to apply. Please remember to certify. If you can do it online, please do. If you have to call in, the number is 877-664-6984. Now, what we are asking people, because our volumes have been so high, is to call in on a day that matches the last digit of your social security number. So we're asking people from 0 to 3, if the last digit of your social security number is 0 to 3, please call in on Monday. 4 to 6, call in on Tuesday. And 7 to 9, call in on Wednesday, with Thursdays and Fridays being left for folks that either missed their day or couldn't get through. And this is a really important message that needs to go out there, because Monday, our call volumes are through the roof. You don't have to apply or certify on a Monday to get your benefits for the next week. You can do it on Friday or Thursday just as well. And Conroy's nodding because he used to have my job. And I'm sure the same types of situations were going on then as there is now. But please remember to call in on those days. I will say there's some good news in that regard. We talked about how many folks on the Pueblos and on the reservations don't have access to internet right now and have to use the phone.
Mm-hmm.
Over the past few weeks, we have every single week added more people to be able to answer the phones. So 3 weeks ago, we actually had 15,000 conversations with people who called into our phone lines. Just this last week, we had over 25,000, close to 26,000 conversations with people. And this upcoming week, we'll be adding about 60 more people to the phones, which will hopefully double our capacity to talk with folks on the phone. So if you have to call in, if you can follow those guidelines that will help keep volumes down per day, we are working as hard as we can to get more people on the phones so we can answer questions and get people into the system.
Secretary, I got a quick follow-up question. Many of the folks that live in tribal communities around the state are, they make a living making pottery and weaving and making jewelry. They're self-employed, but at this time can't sell their art, can't sell those rugs, the pottery, or pieces of jewelry. Do they qualify for unemployment?
So the answer is yes and no. The first answer is no, because in traditional unemployment, the way that the fund that gives out the benefits is put out, you have to have an employer that pays a tax into that fund, and self-employed people do not do that. So they are traditionally not eligible for unemployment. However, at the end of March, the federal government passed the CARES Act. And part of that act is asking state unemployment agencies to develop systems for at least this short period of time that will allow people who are self-employed, who are the 1099 tax folks, to be able to apply. We are hoping to announce a date on that very soon. And when we do, here's what people should look out for. The program is called Pandemic Unemployment Assistance. So as soon as you see that in the media or shared on social media or get a call saying Pandemic Unemployment Assistance will be open on this date, get ready. We will also be putting out 2 other specific pieces of information. One, what do you have to have available? What kind of tax documentation? What kind of proof of residency? What other information do you have to have? And number 2, what are going to be the directions? Now, to get into that system, you're going to have applied for unemployment and get denied. I know it seems counterintuitive, but this is the situation that the federal government set up. So if you've already been denied, hold on, because you'll be able to move right into that system. And if you have not applied, wait, apply, get denied, and you'll move into that system, and we will have step-by-step directions available then. We're also going to be working with Secretary Trujillo pretty closely in the next week to come up with a strategy. So when we figure out how this is going to work, that we can work with her to get the word out to folks. And we're hoping to what we call train the trainers. So have people on specific pueblos and in specific chapter houses that might be able to help local communities navigate this process, because it is fairly complicated.
All right. Thanks a lot, Secretary. I want to spend the remaining amount of our time sharing some questions with the 3 of you. We had tribal members submit them. We wanted to do it in real time, but unfortunately, because of the way we're set up, we had to have them submit them ahead of time. We have a number of questions. We'll try to get to as many of them as we can. But one of the first ones, Secretary Kunkel, had to do with self-isolation and being able to quarantine a family if a family member tests positive for COVID-19. How can they do that and prevent further spread within a family where you might have several generations or a number of family members under one roof?
Thank you. This has been a huge challenge for our tribal communities. There's no question. And there isn't an easy answer. We do immediately call the Department of Health when they get a notice that there's a positive case. We immediately call that person and the tribal leadership and begin looking at where the individual lives and who their contacts are. But frankly, with many, many families, there are multi-generations in one household. The most vulnerable elders are there as well. So we do explore what the possibilities are on the reservation in that particular situation first. But it has become clear, and some tribes actually looked for this ahead of time, try to find vans or other buildings where they could isolate. But as a general rule, that was not available to most tribal members. So through the intervention of the governor and the governors that met with her, the Buffalo Thunder Hotel was identified as a resource for tribal members who could not isolate on their own tribal lands. And we could move people to Buffalo Thunder. It's been a very cooperative, very successful venture. Everyone is to be congratulated for contributing to that. And so when we cannot help a family figure out how to isolate the positive person, and we look at the makeup of the family and who the contacts are, I forgot to speak about contact tracing, we may suggest that people be moved to Buffalo Thunder temporarily until they get through their contagious period. We do not move people who are very ill, because that's not a proper location for a person who is quite ill. And we know that people who are sick would rather stay home. But some people do not have significant symptoms. And we also can move people who've been exposed but that are not yet positive. We move them as well, just to try to limit the spread within the reservation. So there's also some other locations in Albuquerque, but primarily we are locating tribal members at Buffalo Thunder.
Good enough. Thank you, Secretary, for that information. Dr. Scrace, what does your modeling show for, in particular, the Northwest Quadrant, where we see many tribes located, specifically San Juan County, Sandoval County, and McKinley County? What does your modeling, your data show in terms of a surge or a peak, as they call it, or apex, as it's referred to, in that particular area of our state?
Yeah, well, let me just start with talking about the cases that we're seeing this week. At the press conference earlier this week, I mentioned that on Monday and Tuesday, 74% of all the cases in New Mexico were in the 3 counties you mentioned. And I just had our statisticians send me the data for through Thursday, and it's held up at 74% of all cases this week in that part of the state. What we're seeing also, the surge is when the volume of patients coming to the hospital is more than hospital can handle in terms of regular beds or ICU beds or ventilators. And we're predicting the surge will be much earlier in both Gallup and Farmington in that regard, to the point that while we're seeing the social distancing that's happened in the state pushing the peak out further and the surge out further, that has not moved in those counties. So we're looking at the next couple weeks for that surge. The peak, lots of models out there. Our model and many others are looking at more in the neighborhood of mid-May, although we are seeing some counties where, like Santa Fe County, where the disease seems under control and there isn't a growth of cases. And so we have a great group of people modeling this. They have broken it down to county level modeling now, which has been very helpful. We asked that question today about Gallup and San Juan and got that answer. And so planning to provide support for those communities and waiting in other areas.
All right. Thank you, Dr. Scrace. Thank you, Secretary Kunkel and Secretary McCanley. We appreciate your time. Good luck to you, and thank you for all that you're doing during this critical crisis and time of uncertainty. So thank you very much.
Thank you.
Good evening.
I'm praying and thinking of everyone. We are strong and determined to get through this, from my community to yours.
Kawasi Kaitawa Helpa. My name is Georgine Lewis. I'm a member of the Pueblo of Acoma and a member of the New Mexico House of Representatives. I hope this message finds you and your families doing well. I hope you're all doing everything you can to help flatten the curve by social distancing and by staying home. I know this is a tough time right now. I'm keeping all of you in my thoughts and in my prayers. Hachmeth, Gumeth. We're going to get through this together.
Hi, this is Joe Talachi here at Buffalo Thunder Emergency Operations Center. Just wanted to send out my blessings to all of you during this challenging time. We are here to help. And, if there's anything that we can do to be of service to you or to your communities, we are here to help. We are grateful for the opportunity to be here to do what's right for our people, to provide a service, hopefully that benefits all of us. So may you all be blessed, and God bless you and your families, and may the Creator continue to watch over you and your pueblos and your respective communities.
Akuam, this is Derek Lente, State Representative for New Mexico, House District 65. I'm here in San Diego Pueblo with my family. We're urging all of you to please stay home, stay safe, protect your families, and protect your community.
Thank you, everyone, for submitting those messages of hope. We're living through some really unusual and unprecedented times. There are other words to describe this crisis: scary, dangerous, terrifying, crazy, surreal. There's certainly no doubt about that, and here's why. You can go see your friends, relatives, and family, but only at a distance. You can shop, but you have to do it alone. You can be out of school, but you have to stay indoors. You can teach, but not in the classroom. You can pray, but you can't go to church. These are strange times. But there's a lot we can do waiting for our state to reopen. I do a lot of reflecting, thinking about what's important to me. I think about my sons and their families who live out of state, my oldest, who's a doctor at a medical center on the Navajo Nation, working triage, my youngest son, who's out of work, my father, who's elderly and vulnerable, my grandchildren, whom I haven't seen in many weeks, my tribe, hoping it'll remain resilient and can recover. But more than anything, I reflect on the values that have made all of us uniquely the same: faith, friendship, family, love, endurance, compassion, community, hope, prosperity, and most of all, good health. Be well, be safe, be strong. Thank you for joining us, and good night.